Hey everybody, I'm Ruth Norton. I am the President and CEO of the Green and Healthy Homes Initiative. We are headquartered here in Baltimore, Maryland, and working throughout the country at the intersection of climate, health, and housing. We are working to address social determinants of health, opportunity, and equity through healthy housing. What our work really is about is lowering the three things that plague Americans the most these days: the high cost of housing, the high cost of healthcare, and the high cost of energy. And I'm going to talk about our whole house approach that really gets to how do we address these things across the nation through our direct service work, through our technical assistance, and through our policy initiatives. GHHI is the originator of the whole house approach and help to inform that the Healthy Homes rating systems and the Healthy Homes 10 elements of healthy housing for those throughout the country. We're so glad to be here with Climate Tech today, and want to thank Aaron for the invitation. So what keeps us up at night and what drives our work is the 30 million families that wake up every day in unhealthy housing, families plagued by lead, by mold, mildew, and moisture that results in asthma, by trip and fall injuries, issues in their homes, that especially hitting our older adults, and energy efficiency, extreme heat and extreme cold. And how do we think about carbon emitting appliances in housing as it contributes to neurological, reproductive, and cardiac health, as do all of these issues together. You know, asthma is not only the number one reason that kids miss school, but it's also the number one reason that low-income families miss work. And 40% of all cases going into the hospital or emergency room for asthma are caused by lousy housing, unhealthy housing, according to the Robert Wood Johnson Commission on Building a Healthier America. Lead is still a toxic legacy that we have not shed in this country, and both of these issues often are undergirding deferrals on energy efficiency, on weatherization, on our ability to electrify homes. So our work looking at vulnerable children and older adults' ability to age in place with health and dignity really intersect at these four major issues. And I'm going to talk about our approach and what it means and the impact. But the way that we work is in a line, braid, and coordination model that we raised up in our work. Here in Baltimore was raised up by the Obama administration and helped us to transform from our Baltimore work to across the country. And it really was to look at how do we look at human health and physical health of housing? How do we do an assessment? What does the scope look like that integrates various funding streams, whether it's philanthropic, federal, state, and local government, and much more local and state government today, and the private sector, and what I'll call the quasi-private sector, healthcare, public utilities, and the like, that we can address all of these issues in that intersectional way that will deliver on the back end a home that is more stable, more affordable to maintain, that is adding value, and that is providing a place for opportunity. And it includes everything from workforce development up to the final product. But if we get it right, where a child lays their head down at night, where it means that they'll wake up getting to the classroom healthy and ready to learn and not heading to the emergency room or to the hospital. It means that our older adults will age with dignity and health, and that they will be wealth building instead of losing their home, so that we can close the racial divide on appraisals, on intergenerational wealth transfer by real estate, but that we are taking care of all communities in a way that their home is the driving force in that. So what that means is that we are looking at these issues together in our comprehensive assessment that we developed with HUD and the Conference of Mayors and Philanthropy, and it was vetted by the Department of Energy, EPA, HUD in that partnership. It is now being picked up by many, many others across the country in this work, critical work that tells us how do we address everything from lead to solar in housing, and how do we treat that as a way that we can think about moving people off of federal assistance potentially into being able to stand on their own and work, but how do we ensure either way that we're caring for our most vulnerable families and giving the greatest opportunity that comes from that, whether that's creating a job in this work, training people how to be environmental risk assessors who are currently underemployed or unemployed, and moving them to jobs that pay from $75,000 up well above $100,000, how we build a contractor base that can be paid better, but be more efficient and actually save government money by taking an integrated approach, and most of all, our families better because we were there. And we've seen a good bit of evidence that our work out of Green and Healthy Homes Initiative and our work across the country has been vetted by HUD, by universities. And what we are seeing is that at a minimum, we are reducing asthma hospitalizations by 66%. Similar work in our partnerships in Philadelphia, that 76%. Places like Cleveland are at 58%. What we're also doing is moving down, which isn't on this slide, but we're moving down the on average 52% of weatherization assistance deferrals and taking those houses off the deferral list and actually delivering those dollars where they are most needed, because we're integrating that with the underlying health and safety work that causes the deferral. And what that means in human terms is that in our studies, which have been well vetted, 62% increase in school attendance from kids who are chronically missing school to perfect attendance. We're increasing the ability of families to get to full-time work. So hours that were being missed for caring for sick kids, they're now moving to be able to get to work at an 88% improvement rate. We're saving over $2,000 a month in Medicaid savings per patient in the household. And in some of our work, like with WellPoint and other Medicaid managed care, that's closer to $3,000 a month, where we're also delivering 32% per patient per month savings for healthcare. And at a floor, $404 average annual energy cost, recent studies of what we're looking at are around $700 a year, in savings, and where people are able to breathe the air better, that we're able to maintain the home better and have their energy consumption and actual cost lowered, so critical in times like now. The other thing that we're doing is documenting literally thousands of cases across the country, like the Smith family here in Baltimore, the Kelly family that is on the next slide, taking issues where families were not able to function well within their own homes, and they were spending more time on health care or on housing condition. And by braiding these funds together, we get to address the multiple issues that can cause problems in the home, everything from water intrusion to lead paint to indoor air quality to increasingly issues of extreme heat, and be able to then deliver models where people are saving money, kids are getting to school, parents are able to not only get to work, but thrive at work, and save government agencies money by getting rid of duplication of expenditures. We're looking at families with vulnerable children for lead, asthma, injury, and other issues, but also families who have weatherization problems or may have home repair problems, and our seniors, both through our partnership through housing upgrade benefits to seniors, which is a partnership here led by GHHI and Civic Works and many others. We're able to really care for our seniors by addressing long overdue essential maintenance practices, roofing issues, foundation issues, things that kind of get out of hand sometimes when people get older, they're retired, or they're living in communities where there has been deep disinvestment. And instead of people having to move to publicly supported aging in place or even very costly retirement communities, they're able to hang on to their home, they're able to lower their costs, and through our work, we're able to raise their actual value of their home so that they can share with the next generation a more valuable property. We're doing this in lots of different ways, but we're doing it with a health lens. Our driving force behind the work we do is all driven by health. So if it's we're taking families to taking out carbon emitting appliances and moving them to electrification or electric primarily on there with heat pumps and water heaters and induction stoves. We're doing that because we're lowering the particulate in the air. We're making people healthier and we're helping them get a more manageable home for the future. It's great that it improves our climate, but our drivers' health. And we're doing that in lots of different ways. We have the largest healthcare investment in the country in our partnership with Lancaster General Health and the University of Pennsylvania, where we're on our way to doing 3,000 homes in Lancaster City and Lancaster County, looking at lead, looking at healthy housing, looking at indoor air quality. We have helped to create healthy housing funds in places like Michigan. We have led Medicaid managed care projects like here at WellPoint in Maryland and Blue Cross Blue Shield in North Carolina, Affinity and Molina Healthcare in the Bronx, where we are making homes healthier in partnership with healthcare, helping them go upstream and helping us do better by Medicaid standards. And in fact, in our New York work, all of that work and the cost of it is being repaid by Medicaid savings alone. It's standing on that. We're also looking at larger whole house models. We've built a whole house approach for the city of Milwaukee. The Pennsylvania whole house law came out of the GHHI model through our partners Built to Last. And New Jersey and other states are also looking at advancing, including Rhode Island, a whole house model. And the other work that we do on policy has been driving how do we use our networks of care around the country to ensure higher quality in healthy housing. So we're doing the quality assurance work in New York through their social care networks. And we're doing that pre-scope and post-quality assurance work. We're working with states where, like Maryland, where we're a partner in healthy kids, healthy families, using unused children's health insurance dollars and putting that into lead reduction, into asthma reduction, into indoor air quality. And in the state of California, we wrote the seminal research that led eventually to the adoption of the use of the in lieu of practice through Medicaid, where doctors today in the state of California write a script and families can go and hire contractors for their asthmatic patients to improve indoor air quality and lower the incidence of asthma as best practices in what is happening. As I said in WellPoint, the work we're doing here in Maryland, we've had just tremendous results on lowering the amount of emergency room visits, hospitalizations, and we're doing that in a partnership with WellPoint, where they've had that 32% per patient per month savings, $3,000 savings per um, patient on Medicaid. And when we go in for one patient, we will often find in the homes 2, 3, 4, and 5 people suffering from respiratory issues. And if you don't have good indoor air quality, or you have extreme heat, or you have mold and moisture, you're going to exacerbate asthma. We're not trying to cure asthma. We're working through a whole house approach and through cleaner energy to lower the incidence of asthma. So I said in New York and the Bronx, we're working in partnership with state and local health departments, the healthcare entity, and local partners to have that same outcome. And we really appreciate our partnership with the Association for Energy Affordability, where we have designed and launched this model, as well as AIR NYC. And we actually, in that instance, we look at different ways to do this, either through direct contracting using administrative dollars, using social care dollars, or in this case, lending the money up front, getting the return on the back end. And what I do know is through 3 years of the work in the Molina Healthcare, New York Healthy Homes Collaborative work, we have overwhelming significance in terms of children being better and avoiding the costly emergency room and hospitalizations. We're also helping to teach the nation about how to use hubs and intermediaries for that social determinants of health delivery. And one of our examples of that is the work we did to prevent injury for people coming out of the hospital, for disabled populations, not as much the elderly in this instance, and being able to use healthy housing principles to incorporate it even on fall prevention. But one of the things we are clearly focused on is the role of clean energy in making people healthier. And I think all of us watching and participating in climate tech understand lowering nitric oxide, carbon monoxide, and benzene is critical to human health. And I think one of the most underrated impacts of fossil fuels in homes is benzene. You can turn your gas stove off, but the benzene continues to emit into the home. And benzene is a leading cause of cancer. It has neurological impacts. It has impacts on reproductive health, on cardiac health, as do nitric oxide and oxides and carbon monoxide. And it's often people know about carbon monoxide, but they don't know the impact, full impact of fossil fuels. And when they do, they understand the drive to make people healthier. And our partners at RMI did a wonderful study showing, just on the replacement of gas stoves alone, that we would address the 42% increase of asthmatic symptoms for homes that had gas stoves, and a 24% increased risk of it being diagnosed as asthma when you hit the emergency room. Whether it's 32% having experienced the symptoms or 24% of being diagnosed, that is a significant increase on what is often already unhealthy housing. And one of the most important things we can do to improve indoor air quality. So we're working through, and we have another panel that's discussing this at Climate Tech, but we're working through community advisory boards, driving the knowledge base and the choice of where people want to be on improving that indoor air quality through the choice of how they cool and heat their homes, and how do we get homes to be more efficient for health, for housing value, and for the environment. So we're teaching people about what it means to electrify. What are heat pumps? What does it mean when you install one? What's the upside? And if there's, risks about the use during the coldest months, what's the risk there? How to mitigate that? And our work also includes adding solar to this mix, because solar helps to drive costs down further and is a huge complement to our other sources of clean energy in the home. So we do a lot of training, a lot of education, a lot of demonstration, and a lot of implementation with and for our communities. We think clean energy, clean homes, clean home energy is health justice. We talk a lot about environmental justice with lead, but there is an element of health justice that we really want people to understand as we try to improve the housing stock in our most vulnerable communities. And how do we engage people to have jobs in that? How do we monitor that as we advocate for cleaner energy through our utilities and as we think about the future of our planet? So we're doing a lot of that work around electrifying homes and doing a ton of education with residents who can then inform our policymakers. And we do that with data, with case studies, and with good education on what it means to invest in clean energy. It means we're investing in a better economy and supporting the executive order of Wes Moore here in Maryland to advance that work. We also do a lot of publications around this, teaching of other groups who want to advance this work and do this work in community, whether it's doing the assessment work and linking over to the intervention work, or for families to understand what they can do, whether when they go to rent, they go to buy, or they do their DIY. Didn't even mean to rhyme on that, but did. And then we do a lot of valuation for healthcare on the cost savings and the wellness for patients, right? In the end, for all of us, it's about quality of life, it's about health. And so we're looking at the different elements of clean heat and how they all play together, and integrating that into policy recommendations. And I serve on a panel out at the Stanford Wood Environmental Center that we are looking every day on the health benefits from improved indoor air quality, from electrification, from weatherization, and from other work. But I personally take it as a badge of honor to keep kids out of the emergency room, keep them out of the incidents of asthma that are scary, and that keep them out of the classroom, and instead to provide and give a better and more equitable pathway by doing this work. And this study that we did here just shows the overwhelming significance of savings when we are reducing nitrous oxide from morbidity, mortality, and illness. And so we will do a lot of this valuation work for healthcare for governments, and advise a lot of mayors across the country and a lot of Medicaid agencies and healthcare agencies on this work, whether it's Oakland, California, or Detroit, Michigan, or Memphis, or Trenton, or in Lancaster, or Providence, or here in Baltimore, or Jackson, Mississippi, all places where we have grounded direct service work. And cities across the country are adopting this. And the other thing that we're dealing with is a shift from federal agency reliance to how do we pay for this at a state level, at a city level, and as communities together, as we have so many red states and blue states looking at energy efficiency, better indoor air quality, and better lives for their communities. So I'm happy to answer questions. I think we're going to have a little chat here with Aaron, and I'm really glad that you were able to attend Climate Tech. I hope there's great learning out of it. Please count on GHHI as a partner in the work together. And I thank you. And if you get a chance, follow us on Facebook or on Blue Sky or on Instagram, or just call or email me directly. We love our work and we love working with folks like you. So thank you.
Ruth Ann, great presentation. Thank you so much. I appreciate it. Do you have a few minutes for some questions?
Sure do. I'm trying to get out of sharing my slides here. How do I do that? Or you can
You're,
turn that
you've
off,
you've
right?
done it. You've turned it
Okay,
off.
there you go.
That's good.
That's a nice logo you got behind you there, bud. That's
Uh,
great.
Thank you. Thank you. So, what you touched on is what in the industry is known as sick building syndrome, and it was not a thing before the 1970s energy crisis. But, and for those that don't know, the 1970 oil embargo, we had an energy crisis. We clamped down our buildings, made them really energy efficient, and we reduced the ventilation in the buildings to reduce energy costs as well. And the intended consequence is what we now know as sick building syndrome. And my fear,
Actually, Aaron, do you
yeah,
remember? You may not be old enough, but Jimmy Carter sat by a fireside in his
it
Mr.
is
Rogers
sweater.
sweater and, launched the Weatherization Assistance Program.
Yeah.
And what we were worried about then was cold,
Hmm.
keeping people, especially the elderly, warm in winter.
Hmm.
And here we are, less than two generations later, and what are we worried about? Some about cold,
Yeah.
but we're really worried about is this massive impact of extreme heat.
Hmm.
And that can tell you how quickly things can change, right? So,
Absolutely. And I saw pictures of solar panels on top of the White House during
yeah,
the
he did that too.
administration as well.
He did that
Um,
too.
but I
I think Jimmy Carter was the most underrated president in many ways ever.
Absolutely. I remember seeing pictures of him walking through Sandtown with Habitat for Humanity as well. So I guess my concern is that, Maryland has the most aggressive climate law in the country, the Maryland Climate Solutions Now Act. And again, we're tightening up our buildings, we're making them more energy efficient, we're removing the combustibles, making them all electric. But if you're an indoor air quality nerd like me and you walk into net zero buildings or buildings that have gold, silver, platinum plaques on them, but the
Yep.
air quality is not performing very well. My biggest fear with this BEPS law, there is no language in there about ventilation. There is no language in there about, the health and wellness of the building occupant. My fear is that we're going to continue the sick building syndrome phenomenon and not really address it. What's your take on that?
It's really important. I think we ought to continue to not only educate MDE on this, right? But we have to educate the Maryland Department of Health, our local health officers, our local health care to weigh in on this. Asthma clinics should not be seeing kids, right? Where we're doing all of the other building improvements that we should be doing for climate.
Mhm.
Uh, the way that GHHI came into being out of our work as the Coalition to End Childhood Lead Poisoning is because I wrote a paper that got put in the hands of Barack Obama eventually, and I that effectively said, okay, Mr. President-elect, you're about to put $5 billion into weatherization and
Mhm.
start efforts on clean energy. And if you seal up the toxins into the house, you don't remove the paint, you don't address the existing in mold, mildew, and moisture, right? And you close that environment, you will actually send more kids to the hospital. You
That's
will
right.
actually have more brains disrupted by toxins.
Mhm.
So it is that effort of having to understand holistically, right? I remember long conversations with the U.S. Green Building Council saying green, as it's defined at the time, did not mean health,
Right.
right? So out of those two things, we lifted up, and I have to give credit to Vice President Biden for actually telling us that should call it homes and not housing. He
Mhm.
was right because what we're dealing with is people's homes.
Mhm.
Um, but the reality is it's a both and,
Mhm.
right?
Yeah.
And we don't want to keep building laws, regulations, and statutes that we will regret later or have to fix later when we know how to do it today.
Right.
So I think that's advocacy, that's education,
Mhm.
and that's being at the table to really be able to describe through data and through stories, right? Case studies and stories, data with a soul, as Brene Brown would call it,
Hmm.
um, to be able to really present that. But, I think all decisions need to come with evidence, and they need to come with really strong evidence, as policymakers need to focus on evidence. They actually need to focus on a thing called science, right?
Yeah.
And evidence.
And public health and
And all of that
stop
leads, right?
value
Of course.
engineering out public health from the
Yeah,
seat at the
yeah,
table,
yeah,
right?
yeah. Unintentionally, for sure.
Yeah, for sure. So, unfortunately, we can't retrofit our way out of this situation. Home builders, developers have a role to play in building healthy, smart, high-performance homes. How is GHHI working with the builder developer community to do just
Well,
that?
we're just about to release a toolkit
Okay.
for developers, that both those that are taking vacates and bringing them back to life through full gut rehab and new
Hmm.
build,
Hmm.
on how do you incorporate the public health practices, the environmental health practices. So thanks to JP Morgan Chase for supporting that. We're about to unveil to their cohort and the world that work. Um, because in both of these we not only in how we rehab, repair, and retrofit existing housing, single family and multifamily housing,
Hmm.
we have to think about, in Baltimore, the big hit is going to be on how do you take the vacants and give life,
Hmm.
make a choice of those vacants that we should invest in and bring them back.
Hmm.
There's so many hidden dangers in that, right? That all the way from the foundation to whatever that you're building around, you have to think literally from the ground up, and the air out, and circulation. And there's all sorts of standards, from the well building standard and the enterprise community, green community standard. But the practical realities of of how do we build toward indoor air quality? How do we build toward particulate levels, or lowering and eliminating
Sure.
particulate levels? We are not only our work, our direct service work is in existing housing stock, and because we're caring about doing the urgency work around where people are living today,
Hmm.
um, but where they may go is equally important to us,
Yeah.
right? But having a strategy of both is so important to health.
Well, you've got the right partner in JP Morgan. I mean, their new building at 425 Park Avenue in Manhattan is a model for how to really focus on, the health and wellness of the building occupant. Sir Norman Foster, the architect who built that building, they're using reset accredited monitors to validate that the construction and the air quality is performing the way it does. So you definitely aligned yourself with the folks that know how to do it and approving it at a
Well,
large scale in
we're
Manhattan.
grateful that they came and found us, and we're grateful that they're doing that for their employees and
Yep.
helping to do that both in Detroit and Baltimore. But there's so many interested parties in what's happening around these issues. We've been working with Fannie Mae for the past 3 to 4 years, looking at these impacts and how do we use financing tools, not right? How do we build funds? And one of the big things that we're focused on is how in every um, program that comes out of government, state, local, federal, how are they looking at the alignment to have the end result be a whole building or a whole house health, right? Because it's not just structural. It's where it matters is the residents who are using that facility
That's right.
or living there, or as I said in the slide deck, where kids lay their head down at night.
That's right.
What are they breathing?
Hmm. Hmm.
What we breathe and what we drink are the essential elements of how we survive to the future, right?
Yeah,
And
absolutely.
in what shape?
Absolutely. Absolutely. And we can have both. We don't need to sacrifice energy for health
It
or
is,
health
yep.
for energy. We can have both. You've proven that through your whole house retrofit program. I guess my last question is kind of what is the thing that surprised you most about your whole house approach to retrofit?
I think the fears people had about how hard it is, and really how you can simplify that, and how much you achieve, right?
Hmm.
So understanding we were coming from the lead and healthy housing field and got into the energy efficiency. And then as we pulled the thread, right,
Mhm.
clean energy and then solar. Um, but we got into it because we were finding we were making houses healthier for lead. We've lowered lead poisoning. We've led the effort to 99.6% reduction of childhood lead poisoning in Maryland.
That's right.
We were lowering asthma. We were making houses healthier for pregnant women, young children, and they were moving still because the energy was going up out of their roof because they weren't able to deal with the heat and the cold. And so we said we had to do that. So when we started looking at energy efficiency and clean energy and doing it in best practice form, where we had had success of keeping people out of the hospital, keeping people out of the emergency room, that outcome got bigger
Hmm.
and more positive,
Hmm.
substantially. But what we also started to see was increased housing values, lower maintenance costs, more housing stability for families,
Hmm.
and better overall quality of life outcomes. So I would say, I've had many moments in a 34-year career of um, having the tide beat us at the shore, right? We began our work in environmental, social, and racial justice, right? In the country's coming to understand disadvantaged communities was one moment of meeting us at the shore, right? The tide meeting us at the shore, that people were paying attention now in communities where we were paying attention. But we are also getting to that moment about lowering healthcare costs, lowering energy costs, lowering housing costs. I have the chart about the 30 million families that keep us up at night, but what keeps families up at night are those three things.
Right.
And the ability for GHHI and others doing this work, you and others doing this work, our collective ability to address those three things will help all of us do better. And as Paul Wellstone and now Brooke Learman says so often, when we all do better, we all do better.
That's right. That's right. We didn't touch on, maybe you could touch on it briefly before we close out. Maryland has 1 in 4 homes in Maryland have elevated radon levels above the EPA action limit of 4 picocuries per
Such an
liter.
underserviced thing in this state, right?
Yeah.
I mean, second leading cause of lung cancer.
Yeah.
Um, People surprised they're getting lung cancer when they've never smoked.
Hmm.
I think it is we test for it in our process, right?
Hmm.
And often the mitigation is really inexpensive compared.
Right.
In our Salt Lake office, when in GHHI Salt Lake, we really focus a lot on radon, but the I remember we pulled the Radon Coalition together for Salt Lake County, Utah,
Hmm.
and there was a woman in the room who had been through stage 4 lung cancer, was coming out a little bit on the other side of it,
Hmm.
um, but she had radon in her home. The fix was $1,500, but she couldn't find somebody to help her get the $1,500 for the fix.
Hmm.
And her medical bills were more than $1.5 million. Now, if we're putting our business hat on, not only thinking about whether she'll be better, but just think about that in the scheme of things, right? 1,500 or $1,500,000. And how many homes
Yeah.
just in Salt Lake
Yeah.
could have been mitigated
Right.
for 1.5 million and what her life would be like.
Yeah. Yeah. It's a
I
shame.
keep ringing that bell. That's
Yeah,
a big
absolutely. Absolutely. I come to this space from discovering radon in my home here in Randallstown. We've since gotten it mitigated, but had I not gone out and got an air quality monitor to test, because as you know, you can't see it, smell it, or taste it. And it's a pretty major issue. I think each hospitalization is about $150,000 just to get hospitalized for per rate on induced lung cancer. So, Ruth Ann, this has been great. I appreciate your leadership, your thought leadership, your subject matter expertise. Anything that I didn't ask you that you want people to know about yourself or GHHI before we close out?
Well, other than I'm an avid Orioles fan and Ravens fan and the University of North Carolina basketball fan, which means I'm suffering a lot because none of them have lived up to their potential. I'm really passionate about how do we put Baltimore and the state on our backs? How do we actually achieve a clean energy economy? I think I want to see Baltimore live up to its highest potential and Maryland live up to its highest potential. And we only do that when we care for others. We only do that when we really lift communities that have been disinvested. I am a big believer in equity, and I am a big believer that everyone should have opportunity, and that we miss out so much in life if we don't. So we're trying to pick up a small part of the world on this, and we all have to lead together.
Yeah.
But I think that's what I would say, other than the fact that I feel like I have the best team, the best staff in the world. From soup to nuts, and love them dearly. So, and I'm so glad that people like you are doing these summits and really getting the word out. And you're doing a great job. So proud of you too.
Well,
All
thank you
right.
so much. I appreciate that. And I'll bid you goodbye. Have a good evening.
All righty, you too. Thank you. Bye-bye.